Good morning, everyone, and welcome to today's webinar entitled Modifications to Accommodate Disabilities in the Child and Adult Care Food Program and Summer Food Service Program, Updated Guidance. This webinar is being presented by the Pennsylvania Department of Education, Division of Food and Nutrition, in collaboration with Project PA. I'm Elaine McDonald, Director of Project PA, and I will moderate today's webinar. Just a few pieces of housekeeping before we begin. We'll take questions following today's presentation. You can type your questions into the chat box at any time, and we'll collect the questions and save them until the end of the presentation. To submit your questions, just type into the small box at the bottom of the chat box and hit enter, and your question will appear. There are a few items you can download in the file share box in the lower left-hand corner of the screen. Today's slides are available in two formats. The document that starts with slides is 1 slide per page. The document that starts with handout is 3 slides per page with room for taking notes. And there is also a medical plan of care handout. We are recording today's webinar and we'll post the audio from the webinar along with the slides and the Q&A on the Project PA website. Our presenters for today from the Pennsylvania Department of Education Division of Food and Nutrition are Jenny Edmondson and Kathleen Hiltwine, Public Health Nutrition Consultants. And we will just take a second here to pull up their presentation. And I will turn it over to Jenny and Kathleen.
Hi, thanks, Elaine. Good morning, everyone. And welcome to PDE's training on USDA's updated guidance on modifications to accommodate disabilities in the Child and Adult Care Food Program and Summer Food Service Program. The updated guidance from USDA represents a shift in policy regarding the way CACFP institutions and facilities and Summer Food Service Program sponsors are to view and accommodate most physical and mental impairments when providing meals to your participants. Today, we're going to walk you through the new guidance and the resources related to modifying meals to accommodate children and adults with disabilities that you serve. And as Elaine said, we'll answer your questions at the end. Our objectives include a brief review of the laws, regulations, and other legal authorities that provide the framework for civil rights protections in federal programs, which of course include the child nutrition programs. Specifically, we're going to focus on the laws that prohibit discrimination based on disability, including an explanation of how the Americans with Disabilities Act Amendments Act of 2008 expanded and clarified the meaning of disability. USDA released a new policy memo on June 22nd, 2017 that updated the guidance on accommodating disabilities in CACFP and the Summer Food Service Program. We will review that new guidance and how it pertains to your duty as program operators to accommodate participants with disabilities to ensure that they have an equal opportunity to participate in the meals that you serve. As you'll see on this and the next slide, there are a variety of civil rights laws, regulations, and executive orders that apply to federal programs, in addition to other resources that provide relevant guidance on civil rights. We're not going to discuss these in detail, and these slides are not an exhaustive list, but we're providing them here as a reference for you. For purposes of today's webinar, the primary focus is Section 504 of the Rehabilitation Act of 1973 and the Americans with Disabilities Act of 1990, or ADA, which was modified substantially by the ADA Amendments Act signed by George Bush in 2008. You will find most of the civil rights regulations pertaining to the child nutrition programs in Chapter 7 of the Code of Federal Regulations, or CFR, Part 15. The section of the regulations that specifically addresses disabilities is 7 CFR Part 15B, and that's titled Non-Discrimination on the Basis of Handicap in Programs or Activities Receiving Federal Financial Assistance. An electronic link to these regulations is included in the updated medical plan of care form, which is posted on PAIR's download forms in the form section. And it's also available for you to download during today's webinar from the file share box, as Elaine mentioned. I just want to show you this slide. It's a snip from the first page of that medical plan of care form, and that red arrow is just pointing to the blue hyperlink that you can click on that will take you to the federal regulations. We are going to talk a little bit more about the medical plan of care form later in the presentation, but we just wanted to show you how you can easily access the regulations using that link. Section 504 and the ADA are the two key statutes that hold up disability law and prohibit discrimination based on disability. There are also implementing regulations and policy guidance that provide further directions, some of which we included on the previous slides. In addition to preventing or prohibiting discrimination based on stereotypes of people with disabilities, both Section 504 and the ADA require operators of the child nutrition programs to provide reasonable modifications to ensure equal access and opportunity for participants with disabilities to participate in and benefit from federal programs. This includes providing special meals at no extra charge to participants with disabilities that restrict their diets. It's important to understand and accept that the duty to provide modifications is sometimes not a black or white issue. Instead, each situation is unique and requires a case-by-case analysis. So today, we're going to provide some guidance to help you make those decisions. We want to stress that the focus for you as a program operator is what can be done to ensure equal opportunity for participants with disabilities to participate in and benefit from the CACFP or summer food program meals. The ADA Amendments Act of 2008 expanded and clarified that Congress intends the term disability to be broad and inclusive. In addition, the expectation to provide a reasonable modification has not changed. The ADA Amendments Act placed the emphasis on the duty of program operators to provide that reasonable accommodation. Additionally, the disabled person does not carry a high burden of proving that he or she has a disability. Because the ADA Amendments Act simplified the question of whether a person has a disability, for purposes of making accommodations for meals, program operators do not need to do extensive analysis or weigh medical evidence against a legal standard to determine whether a particular impairment is severe enough to qualify as a disability. After the passage of the ADA Amendments Act, most physical and mental impairments will constitute a disability. The legal definition of disability has not changed. There are potentially 3 different avenues for establishing that a person has a disability. The first one is a physical or mental condition that impairs and substantially limits one or more major life activities. It's also possible under the definition to qualify for civil rights protection if a person has a record of having a mental or physical impairment in the past or is simply regarded as having such an impairment. These second 2 definitions generally play a role in civil rights claims that are based on stereotyping and negative views about people. Today, we're talking about modifications to program meals, which is normally tied to that first definition, a person with a physical or mental impairment that substantially limits one or more major life activities. The ADA Amendments Act revised what constitutes a substantial limit and made it very clear that this is a low threshold. A physical or mental condition does not need to prevent or significantly or severely restrict a major life activity to qualify as a substantial limit. So questions about the severity of a participant's disability are not as important or relevant to the discussion, and each situation requires an individualized assessment. The assessment must be made without considering the effects of measures that might mitigate or improve the condition. So, for example, the fact that a participant may be able to control an allergic reaction by taking medication should not be considered in determining whether the allergy is a disability. The revised definition of disability may include impairments that are episodic or in remission if the impairments would substantially limit a major life activity when they're active. This expanded definition provides some direction about the intent of the ADA. The intent is to make the question of whether a person has a disability a very simple and low standard for people to meet, and to shift the focus to what is required to give them equal access. For someone who might have a disability that's in remission, for example, there's no need to argue about whether that person has a disability. Instead, you would talk about what accommodations are necessary while the person is in remission, which might be much less or even none at all compared to when the condition is active. Part of the definition of disability is that the condition substantially limits a major life activity. The ADA makes it clear that major life activity is broad and inclusive. Seeing, hearing, walking, speaking, learning, reading, eating, and breathing are examples of major life activities. Major life activities also include the operation of major bodily functions. According to the ADA, most physical and mental impairments will constitute a disability. This includes conditions that impair immune, digestive, neurological, and bowel functions, as well as many others that could require modifications to meals. For example, digestion is a major bodily function. A child whose digestion is impaired by lactose intolerance may be a person with a disability, regardless of whether or not consuming milk causes the child severe distress. As sponsors of federal meal programs, you receive federal funds and are required by law to accommodate disabilities in program meals. We also want to remind you that under Section 504, an organization that receives even $1 in federal money brings the entire scope of the operation within the jurisdiction of Section 504. And this is true even when the modification requested is not related to the part of the operation that is receiving the federal financial assistance. Section 504, the ADA, and federal regulations establish several different types of discrimination. There could be general discrimination because of a disability, including denying of benefits or the opportunity to participate in the program. It could be segregating individuals with disabilities. So, for example, requiring participants to sit at a separate table can sometimes constitute discrimination. And aiding or contracting with others who discriminate. By taking federal money for the child nutrition programs, sponsors and program operators are accepting the duty to ensure that the people they work with and therefore pass those federal benefits on to also are not discriminating based on disability. Another type of discrimination is failing to provide a reasonable accommodation, because when you accept federal money, you are required to ensure equal access to program benefits, which may include modifications or substitutions to the meal pattern or to the meal service. The last two types of discrimination on the screen are important to know, but they are not addressed directly in the guidance we're providing today. It is considered discrimination when effective communication is not provided to persons with disabilities, such as individuals with hearing impairments or other conditions that would require a special accommodation for effective communication. And finally, facilities are required to be accessible, such as for individuals with conditions that affect their mobility. On June 22nd, USDA issued updated guidance on modifications to accommodate disabilities in the CACFP and Summer Food Service Program. It's listed there on the slide, and it is also found on download forms. USDA will be releasing additional guidance on accommodating special dietary needs and preferences that are not related to a disability at a later date. Let's take a look at what the new USDA guidance tells us about making reasonable accommodations. Program operators must make reasonable modifications to the meal, including providing special meals at no extra charge, to accommodate disabilities that restrict a participant's diet. A reasonable modification is a change or alteration to a policy, practice, or procedure that provides a person with a disability the opportunity to participate or benefit from the services of the program, which are equal to those afforded to any other participant in the program. An example of a reasonable modification to a meal would be substituting a soy beverage for a participant who cannot consume fluid milk as a result of a milk allergy. Another example of a reasonable modification would be changing a program practice, such as providing a participant with diabetes a reimbursable snack outside of the normal meal service time based on that participant's medical need to eat at regular intervals throughout the day. So how do program operators decide what modification to provide? The regulation provides a standard that says programs must provide whatever would allow the participant to equally participate and benefit from the program, which essentially means providing equal opportunity. In order to arrive at that modification, program operators must work with the family, the adult participant, or the person acting on behalf of the adult participant to discuss what modification would work the best. Simply saying no is almost never appropriate. Program personnel need to talk with family members to discuss the limitations and barriers that exist, ways to overcome or eliminate those barriers, and what modifications are available that can allow equal access for the child or adult participant. The focus of the discussion should be on what modification should be implemented that is effective and reasonable. It should be a cooperative process that allows the parties to reach an agreed upon modification. Again, the focus should not be on whether the person has a disability, nor should it require extensive analysis. Instead, the central concern for program operators should be how that participant can be accommodated to meet his or her need and ensure they can participate equally in the program. Because circumstances vary, even when a person's disability diagnosis might be the same as another participant in your program, each situation needs to be treated on a case-by-case basis. The modification request must be related to the person's disability or limitation. For example, a participant with a vision impairment might need a modified version of the facility's menu, but they would not be entitled to a special meal because that is not related to having a vision impairment. Program operators are not required to provide the exact substitution or other modification requested by the family or participant. However, they are required to work with the parent, guardian, participating adult, or person acting on behalf of an adult participant to provide a reasonable modification that is effective in providing an equal opportunity to participate and benefit from the program, and that effectively accommodates the person's disability. For example, if a family requests a brand name item, in most cases, a less expensive generic brand is sufficient, unless the brand name item is medically necessary. And this can be determined through that cooperative discussion process with the parents or guardians. Even when the participant's family and the program operator don't agree, the reasonable modification should still be provided. The center, home, or sponsor should implement the modification that it believes is effective in order to comply with the law. Program operators are not required to make modifications that would fundamentally alter the nature of the program. The phrase fundamentally alter refers to a significant change in how the program is run or the services or benefits provided. USDA recognizes that unlike the school meal programs, the CACFP and summer food service program may be operated by very small entities with extremely limited staff and resources. In these situations, some meal modifications might be so expensive that providing them would make the continued operation of the program unfeasible. Modifications that are so expensive that they would make continued operation of the program unfeasible constitute a fundamental alteration in the nature of the program and are therefore not required. For example, providing an expensive medical infant formula to accommodate an infant's disability could be so financially burdensome for a CACFP daycare home with one staff member, that it would make operating the program unfeasible and consequently would fundamentally alter the nature of the program. In this example, the CACFP daycare home would not be required to provide the requested medical infant formula. Keep in mind that the expense of a modification is measured by the total resources available to a particular program operator. So larger centers and facilities would normally have greater resources available compared with a small daycare home. Program operators concerned that a requested modification would fundamentally alter the nature of the program should contact PDE for assistance. There are some key considerations that program operators should keep in mind when making reasonable modifications. As we discussed a bit already, program operators should certainly consider cost and available resources when making decisions regarding modifications. When faced with a very expensive request, program operators are encouraged to discuss options with the parents or guardians because there may be a more cost-effective substitution or modification that could effectively accommodate the participant. When deciding between multiple options, your program may choose the most cost-effective option as long as the modification is effective at removing the barrier and ensuring the participant has equal access to program benefits. We also encourage you to consider the age, maturity, mental capacity, and physical ability of the participant when determining what an appropriate modification would be. For instance, younger children may require more assistance with selecting and eating their meals compared with older children and adults who may be more able to take responsibility for some of their dietary decisions. One size does not fit all, so the modification decision should be tailored to meet the individualized need of the disabled participant. The modification does not need to mirror the menu item that is being substituted. So let's say that a daycare center traditionally serves pizza on Fridays, but a child is allergic to dairy foods and cannot consume the pizza. The daycare center is not required to provide a dairy-free pizza or any other form of pizza as a substitute. The center may choose a different item altogether and make that available to the child as a reasonable accommodation. Lastly, program operators are not required to accommodate lifestyle choices. General health concerns, such as a parent's preference that a child eat a gluten-free diet because the parent believes it is healthier for the child, rather than because the child has celiac disease, are not disabilities and do not require a modification. Meal modifications that program operators choose to make for religious, ethnic, moral, or other reasons are reimbursable as long as those meals adhere to the required meal patterns. I'm going to turn this over to Kathleen now.
Now let's talk a little bit about food allergies. According to the Centers for Disease Control and Prevention, there are 8 foods or food categories that account for 90% of serious allergic reactions in the U.S. They include milk, eggs, fish, crustacean shellfish, wheat, soy, peanuts, and tree nuts. A food allergy is an immune system reaction that occurs after ingestion of a certain food. An allergic reaction may impact one or more major bodily functions or other major life activity, such as digestion, respiration, immune response, skin rash, etc. Therefore, food allergies will generally be considered a disability under the expanded definition of a disability under the ADA Amendments Act. A food allergy does not need to be life-threatening or cause anaphylaxis in order to be considered a disability. Questions frequently come up regarding peanut allergies and whether it is recommended to establish a peanut-free policy. It is not a USDA or a PDE policy to require universal exclusions of a specific food or food group. Deciding whether to enact a policy excluding a specific food or food group is at the discretion of the site, center, or home based on your circumstances and your participants. We caution that if you have implemented such an exclusion, bear in mind that such a policy may be viewed as a guarantee that some families will rely upon. Unless you can ensure that all of your facilities are peanut-free 24 hours a day, and that there won't be an exposure when the participants interact with different parts of the facility, such a policy may not be effective. We also want to mention that prior to this new guidance, your program may have considered and accommodated certain meal modification requests that were viewed as optional to make at the time. It is possible now that under the ADA Amendments Act, those meal substitutions that were determined to be optional at that time may now be required if the individual for whom the request was made is disabled. As stated earlier, a food allergy does not have to be life-threatening to be a disability. Similarly, food intolerances may be considered a disability if they substantially limit a major life activity. So for example, if a child's digestion, which is considered a major bodily function, is impaired by gluten intolerance, their condition may be considered a disability regardless of whether or not consuming gluten causes severe distress. Now let's touch on program accessibility. This is a whole other area of law and guidance, but we want to make sure that program operators are aware that they must ensure that their food service areas are accessible to participants with disabilities, and that there is an independent obligation to provide auxiliary aids and services as needed for a participant to benefit equally from the federal child nutrition program. Some examples of auxiliary aids and services include food service aids, adaptive feeding equipment, meal tracking assistance, and other effective methods that facilitate equal access to program meals for children and adults with disabilities that you serve. We talked about what a reasonable modification is and how to arrive at that determination through interactive dialogue with parents, guardians, or the person acting on behalf of an adult participant. Now we'll talk about where the modifications need to be provided. Section 504 specifically requires that program operators provide all meal services in the least restrictive setting appropriate to the needs of the participant with a disability. Meal modifications and meal service should occur in an integrated environment wherever possible. Excluding a participant from the program environment simply as a matter of convenience for the center or site is not considered an appropriate or reasonable modification. We do know that this can be tricky because when children with severe food allergies interact with other children who don't have allergies, there is a potential for exposure. Prior to developing a special seating arrangement for a child with a severe food allergy, for example, the program operator should determine, with input from the child's family and medical provider, if this type of seating arrangement would truly be helpful for the child. If the center or site does develop a special seating arrangement, other children should be permitted to join the child with a food allergy, provided, of course, that they do not bring any foods that would be harmful to the child. Program operators should also keep in mind the stigma that may be attached to a participant who is assigned a seat at a separate table or in another room. We want to discourage that practice where possible. However, if safety demands that the child be closely monitored or eat in an area separate from where the majority of the participants eat, it is not appropriate to simultaneously use this area to segregate children who are being punished for misconduct. Program operators must obtain a written medical statement from a state-licensed healthcare professional in order to receive reimbursement for meals served to children or adults with disabilities that do not meet program meal pattern requirements. In Pennsylvania, a licensed physician, certified registered nurse practitioner, physician assistant, or dentist may write medical prescriptions and therefore may write the medical statement. Program operators do not need a written medical statement for modification requests that are within meal pattern requirements. So for example, if a participant has a common allergy to one fruit or vegetable, the program operator can simply substitute another fruit or vegetable in the reimbursable meal or snack. Although program operators will be reimbursed for a modified meal that is within the meal pattern, regardless of whether they have obtained a written medical statement, Program operators may choose to request a written medical statement in support of a request for a modification in all cases if desired. This will help to safeguard participants in all areas of the facility and reduce misunderstandings and miscommunications. The updated USDA policy guidance tells us that the written medical statement must include information about the participant's physical or mental impairment that is sufficient to allow the SFA to understand how it restricts the participant's diet, an explanation of what must be done to accommodate the participant, and the food or foods to be omitted and recommended alternatives if appropriate. So, for example, this would be appropriate in the case of food allergies. Medical statements are often written on the medical provider's prescription pad or on their medical practice's letterhead, and this is acceptable. PDE recommends that program operators provide PDE's medical plan of care form to the families of participants requesting a meal modification. This is the form that we mentioned at the beginning of the presentation. For those of you who are unfamiliar, PDE's medical plan of care form provides information about accommodating disabilities in your programs, and it is attached to a form that can be completed and signed by the participant's medical provider. As you mentioned earlier, the form is posted on pairs, download forms. It can be found in the forms section of CACFP's download forms and in the Feeding Students with Disabilities and Special Dietary Needs section of the Summer Food download forms. And it is also available to download during the webinar today. The medical plan of care form includes prompts for the information required to make modifications to meals for participants with disabilities, and it includes a space on page 2 where you can insert the name of your program and contact person. There is also an optional HIPAA sign-off, which may allow program operators to obtain further clarification from the medical provider when the information provided on the form is unclear. PDE recently updated the medical plan of care form to align with USDA's new guidance. Program operators who may have printed prior versions of the medical plan of care form to give to families of participants should discard them and begin using the new form as soon as possible. So here is an example of what the medical statement should contain for a food allergy. The medical statement should identify the food to be avoided and provide a brief explanation of how exposure to the food affects the participant. So for example, it may say, Johnny should not consume eggs. And the brief explanation may be that when consumed, eggs cause a rash and breathing problems. The recommended substitutions must be provided. If for some reason the medical statement does not identify a recommended substitute, program operators must reach out to the family to obtain that piece of information. Omission of a substitute or substitutes does not mean that the program operator is not required to honor the request, and we'll talk more about that on the next slide. If the modification request is not related to a food allergy, the 3 components of the medical statement are very similar. The medical statement should indicate the existence of a mental or physical impairment. It does not need to include a medical diagnosis. Second, it must explain how the impairment impacts the participant's diet. And third, it must describe the modification that is needed or recommended. Again, if the modification is not specifically listed on the statement, program operators should go back to the family and seek the information so that you can arrive at a modification decision. USDA guidance provides some additional information that program operators need to know related to the written medical statement. The medical statement is no longer required to identify the specific disability or to use the terms disability or disabled. Program operators may not request a diagnosis or medical charts or other documentation. Instead, the medical statement only needs to include a description of the participant's physical or mental impairment that is sufficient to allow the program operator to understand how it restricts the participant's diet, and to understand what modifications are needed to accommodate the participant's impairment. When they are received, program operators should not be engaged in questioning whether the stated medical or physical condition is severe enough to be a disability. This is beyond what is needed to make the modification decision. You should not deny or delay a requested modification because the medical statement is unclear or does not provide recommended alternatives. If a medical statement does not fully explain the modification needed, the program operator should immediately contact the child's parent or guardian, adult participant, or person acting on behalf of an adult participant for guidance, and ask the family to provide an amended medical statement as soon as possible. Program operators should follow the portion of the medical statement that is clear and unambiguous to the greatest extent possible while obtaining additional information. You should not unduly delay a participant's meal modification while waiting for the family to submit an updated medical statement. In this situation, program operators or officials should follow up with the family if you do not receive the requested medical statement as anticipated and maintain a record of this contact. Program operators or officials should diligently continue to follow up with the family until a medical statement is obtained or the request is rescinded. USDA does permit program operators to claim a meal outside of the regular meal pattern for reimbursement while actively following up with the family and documenting the process. Let's address how to implement the guidance and the particular requirements that are highlighted in the guidance. First, program operators are encouraged to implement procedures for parents, guardians, participating adults, or persons acting on behalf of adult participants to request modifications to meal service for persons with disabilities and to resolve grievances. If a participant needs a modification, the family should know the procedures the program operator has in place so that the modification can be requested and a prompt and equitable decision can be made on what modification will be implemented. Second, program operators should ensure that center, daycare home, summer site staff, and any volunteers understand the procedures for handling requests for meal modifications. The ability to implement the requirements really depends upon everybody knowing what they are. Third, regulations require that program operators employing 15 or more individuals designate at least one person to coordinate compliance with disability requirements. This individual is often referred to as the Section 504 coordinator. This person does not need to be a new hire or someone who is exclusively dedicated to being a coordinator under Section 504. The Section 504 coordinator may be someone who already deals with special education services in your program, or it may be an existing member of the staff who can have the duties in addition to his or her regular duties. In many cases, the 504 coordinator is responsible for addressing requests for modifications in general. So as part of their general responsibilities, this individual might also be the person responsible for ensuring compliance with disability requirements related to meal modifications and the meal service. Either way, there does need to be a person appointed and identified as a point of contact to ensure compliance with the regulations and current guidance if you employ 15 or more staff. The process of providing modified meals for participants with disabilities should be as inclusive as possible. It's essential that program operators work collaboratively with families to ensure participants receive a safe meal and have equal opportunity to participate in the CACFP and summer food service program. USDA and PDE strongly encourage a team approach. The most effective team will include individuals from the sponsoring organization, center, daycare home, or summer site, and the Section 504 coordinator where there is one. You may also want to include others with training in this area if available, such as a nurse or dietitian. Using a team approach helps ensure information is shared consistently throughout the program environment. As I mentioned on the previous slide, program operators that employ 15 or more individuals are required to provide notice and information to families, adult participants, and persons acting on behalf of adult participants regarding how to request a reasonable modification and their procedural rights. This procedural safeguard process is found in our program regulations at 7 CFR 15B. These are the same regulations that we referenced at the very beginning of the presentation, which you can access through the hyperlink on page 1 of the Medical Plan of Care form on PAIRS. Program operators are required to notify the family once a modification decision has been made. In the case that the family or adult participant does not agree with the modification decision, they must be made aware of their procedural rights. At a minimum, this would include the process for filing a grievance or disputing the modification decision made by the program operator after review of the record, how to initiate the impartial hearing process to resolve grievances related to requests for modifications based on a disability, in which families and their legal counsel can participate. This is the typical IEP 504 process that most operators and larger institutions already have in place. Meal modification decisions are now under the umbrella of the disability issues that are handled under the IEP 504 impartial hearing process at a school, site, or institution, and the procedure for the family to appeal any decisions made during the hearing that they may not agree with. And that is all.
Okay, thank you, Jenny and Kathleen. We do have a few questions. First, will we get something proving we went through this program today?
Well, I think we're unsure about why you would need one. If for some reason you need proof of listening into today's webinar, for some reason we're not aware of, please email us and we can see what we can do about that.
Okay, we have a child that eats organic. Parents provide meals. Parent went to the doctor and brought us a medical plan of care form. Do we count them in meal counts/attendance?
Sorry for the delay there, folks. We were just having a discussion on our end. So in light of the new meal pattern changes that take effect October 1st, parents can supply one food component of a reimbursable meal. So that meal, a meal for that child can be claimed for reimbursable if the child provides the meat or meat alternate, as long as the center provides all other meal components. It's hard to understand why or how or which disability would require that child to consume organic food. So I think in order to accommodate that child with the documentation provided, it would probably be in your best interest to maybe engage in further conversation with that
that family to better understand what's behind that request. But I don't know that a medical provider would provide a medical statement for a child with a disability, only due to preference of consuming an organic meal.
There was a follow-up that I think you basically answered, but I'll still read it, along with the question about organic food provided by parents. If a parent provides the main protein, but child eats our vegetables and fruits, should we count them in our meal count?
And in that situation, yeah, you could. That meal would still be reimbursable as long as you're providing all other meal components.
Okay, does the medical plan of care form need to be updated annually?
It's not required that the medical plan of care form be updated annually. It's always encouraged just to make sure the circumstances haven't changed, and the medical plan of care form should be updated if anything does change. But no, it's not required as long as the situation stays the same.
Okay, then we had a couple of questions that I answered in the chat box, but just so that no one missed them. There was a question about if the webinar is being recorded, and yes, it is. Today and tomorrow's webinar will be recorded, and we will post one of the versions on the Project PA website in about a week, and the address, which is listed in the chat box, is www.projectpa.org. And then also there was a question about having access to today's PowerPoint, and yes, that is available in the file share box in the lower left-hand side of the screen. There are the slides available in two formats, along with the medical plan of care form that you can download and print. Okay, if a parent states their child has a lactose allergy, does a note letter from the PCP count, or does the medical plan of care need to be completed?
So because a lactose-free or reduced milk is an allowable milk or alternative to regular fluid milk, it's the same thing. The difference is that the lactose is removed. You can actually make that modification without having documentation. So it's not required that you have the documentation in order to make that change to the meal. But of course, if you do receive documentation requesting that modification be made, I mean, you can, you don't have to hesitate to make that accommodation.
And I think maybe just to clarify, Tracy, you might have been asking whether they have to use that medical plan of care form, or if a note from the primary care provider is acceptable when they don't use the medical plan of care form. And it is, as long as the note from the medical provider contains the information that's needed. It does not have to be on that medical plan of care form. We just recommend using that because it prompts the provider to give the information that you need, prompts for the signatures. It does have that HIPAA sign-off, which can be helpful, but you definitely can accept a medical note that's on the prescription pad, or, that comes from on the letterhead of the medical practice. That is also allowable as long as it has the information you need to make the accommodation.
If we have a child who is lactose intolerant, can we now claim their meals if they're not drinking cow's milk? In the past, since it wasn't life-threatening, it didn't count as an allergy. Is the meal now reimbursable even if milk isn't served?
The fluid milk component has to be served in order to claim that meal as reimbursable. Again, lactose-free milk can be served without having medical documentation. So that would be an appropriate substitution in this case. The only way that you can claim that meal for reimbursement without the fluid milk component is if, for some reason, a medical provider provided documentation based on having an intolerance to lactose that recommended that the fluid milk component not be offered, and perhaps something else be offered in place of it, or nothing. But yeah.
What if a child arrives after mealtime? Can they still be served a reimbursable meal, and would that be a reasonable accommodation?
This doesn't seem to be a disability question. That sounds like a child arriving, late, maybe because of transportation issues or something like that. So it kind of seems to be more of a question for the program, whether they would have the meal available, in that time frame to serve the child, which we would encourage them to do, certainly if they can, even if the child's late. But this doesn't seem to be a disability question where this is a reasonable accommodation.
If the parent provides all components for organic, it is correct not to count them in meal counts. Or is it correct not to count them in meal counts?
Yes, that's correct.
Okay, we don't have any questions at the moment, but it looks like people may be typing, so if we just give it a few minutes. Okay, please give the website again where we may go to get this training again. It's Project PA. It's www.projectpa.org. It's listed above in the chat box where I typed it. Okay. Can we claim a meal if almond milk is served as a replacement for milk as recommended by the doctor? In the past, we were told that almond milk is not an appropriate substitute. Is lactose-free milk the only reimbursable milk substitute?
So I know that substitutions for fluid milk are a source of confusion for a lot of people. In the case of a disability, when you have a medical note from the provider, you are to provide the substitute that is listed by the medical provider. So in this case, if the medical provider lets you know that the participant has can't drink milk, it makes them sick, and recommends almond milk as the substitution, you should follow what the medical provider is telling you to give them, which would be the almond milk. When a center chooses to accommodate a non-disability, let's say the family's vegetarian and they ask you if you could provide, a vegetarian substitute, a non-dairy substitute for fluid milk, that's not a disability, but you would have the option in that case to offer a nutritionally equivalent non-dairy beverage. That is when you would need to, when you could not opt to give them almond milk because there is no nutritionally equivalent almond milk on the market at this time, but there are nutritionally equivalent soy milks that you could provide. So just in your mind, just remember if it's a disability and you have the paperwork and you would give whatever substitute the medical provider tells you to give for that child. In non-disability cases, a preference or, a choice, that is when you would need to give the nutritionally equivalent substitution.
I think this is one I can address. How long will this training be available on the website? Once it's posted, our webinars are basically there indefinitely, so it would be there for quite a long time. I would say probably unless something changed and made the content that was provided no longer accurate or up to date, but you can expect it to be there for quite a while once it's posted. If we have a no nut, no peanut policy, but would be asked to serve almond milk due to a disability, what would you recommend us doing?
So we talked a little bit during the presentation about why exclusion policies such as a nut-free policy can be a bit tricky. If you are in this situation, I think what we would recommend is engaging in further dialogue with the medical provider, maybe starting first with the family, just explaining your situation, the policy that you have in place, and see if there's any appropriate alternatives to the almond milk substitution.
Okay, if parent provides almond milk and we provide all other components, why can't we claim the meal? I'm asking because it was said that meals are reimbursable if parents provide one component and we provide all other components.
So even when parents provide one component of the reimbursable meal, that component still needs to be compliant. And like Jenny mentioned, there is not an almond milk option on the market that is considered to be nutritionally equivalent to cow's milk. So that almond milk component that the parent provides wouldn't credit toward a reimbursable meal. Again, if they receive documentation from a doctor stating they recommended almond milk as a substitute for some medical impairment, then you could proceed with making that accommodation. But if a parent is providing that component due to a preference, then that meal would not be reimbursable.
Okay, it doesn't look like we have any more questions at this time, and I don't see that anyone is typing questions at the moment, so I guess we are ready to wrap up. Thank you all for joining us today. Thank you, Jenny and Kathleen, and again, look for the webinar to be posted on the Project PA website in about a week or so. Thank you all.
Thanks, Elaine.